Today we are going to discuss in clinical pharmacy about the drug-induced diseases. Drug-induced disease means the diseases which are produced by the drugs. Drug-induced diseases are adverse effect of the drug on different organs or part of the body. They may be predictable or unpredictable. Like aspirin, it will give excess dose of the aspirin. We can predict that it will cause a gastric bleeding, right? Drug-induced diseases like a paradox, drug or medication are taken to treat disease. The last thing, one good aspect is that the medication used to relieve discomfort would actually do harm. We're taking drug for the treatment purpose, but it is also causing a harm to the patient. Drug-induced diseases refer to those adverse effects of the drug that are serious enough for the patient to consult a doctor or get hospitalized. The effect may persist even after the treatment with the drug has been discontinued. Even if you discontinue, the side effect will continue. Adverse drug reactions are a reality, it's a fact. Then why do we use drugs? It's a question. Drugs are approved for use only if their potential benefits far outweigh the risk involved. Means benefit is more and risk is less, then we use the drug. Though we know the drug causes side effects. Also, not all people reach similarly to a drug. It is possible that a particular drug, while completely benefiting some people, may cause a potential life-threatening adverse effect on some others. Every drug undergoes extensive testing before it is introduced into the market, as we know that phase 1, phase 4 trials we do. This includes testing in animal, and only once the safety and efficacy of the drugs are established, it is tested in the human. Once approved, it is introduced into the market. So there are three processes. First process is that we select the drug. Number two, we apply on animals and test on the animal, toxicology and teratology test, means genetical changes and toxic changes. And then we go, after animal, we try to test it on the healthy humans. And then phase 2 and phase 3, we go for the patient, to treat the patients. Then we introduce into the market. Unfortunately, several adverse effects appear when the drug is introduced into the larger population. Means if you are trying this drug in smaller population, you may not come out with any such side effects. But when you increase your population to whom you are giving this drug, then you will see some side effects. Many drugs have been labeled changes, introduction of the black box warning on the label. Certain drugs have a warning on the label that be careful while using this drug. Or had to be withdrawn due to the decision. If it is giving too much side effect, then we have to withdraw the drug from the market. These adverse effects come to the notice of authorities either through spontaneous reporting by the physician or various studies conducted. So now we understand that drug is used for the treatment purpose, but it also causes certain side effects. Type of the drug-induced diseases, you can see drug diseases caused by drug can be either predictable or unpredictable. Predictable effects are an extension of the normal pharmacological action. हाँ, no problem. हाँ, थोड़ा काम कर। Extension of the normal pharmacological effects of the drug, for example, blood thinner, anticoagulants, antiplatelet drugs that are used to prevent clotting of the blood can cause bleeding at the side effect. Several anti-diabetic medications like insulin and sulfonylurea, which is an oral anti-diabetic drugs, can cause low blood glucose level, which is there in hypoglycemia. That can lead to the shock also. On the other hand, predictable effects are completely unrelated to the unpredictable effects, which cannot be predicted. Effects are completely unrelated to the therapeutic effect of the drug. For example, amiodarone, a drug used to treat abnormal heart rhythms, can cause lung damage. Depending on the severity, drug-induced diseases may be classified as a mild, moderate, severe, or lethal if they cause death. So, the drug-induced diseases can affect various organs, systems of the body. Several drugs have been banned because of their ability to cause serious side effects. The list of the drugs that cause diseases can go on so several pages. Here are some examples listed below according to the organ system affected. Means there are certain drugs which affect on the organ or system. For example, in cardiovascular, rifecoxib is an non-steroidal anti-inflammatory costool inhibitor. Cocktail inhibitors, painkillers, was introduced with the hope that it would avoid the adverse effect of non-steroidal anti-inflammatory drug NSAIDs, like stomach ulcer. Unfortunately, its use was associated with the cardiovascular events like a heart attack and stroke, and the drug has to be withdrawn from the market. Since the drug is very good, it's very effective in the joint pain, but it causes severe side effects on the heart, means cardiac failure or cardiac attack. Several drugs used for the treatment of obesity met a similar fate. For example, fenfluramine and dexfenfluramine affected the heart valve, while sibutramine was associated with the cardiovascular events in stroke and therefore had to be removed from the market. So there is example of lots of drugs are such drugs which were available in the market, but now those drugs are causing severe damage to the organs. So that's why those drugs have been withdrawn. Several drugs have been associated with the congestive heart failure. These include antidiabetic drugs, ro- uh, like rosiglitazone. So we have to consider each and every aspect of the drug, how effective the drug is and how harmful the drug is, and is it good to give these drugs to the patient or not for the benefit of the to give benefit to the diseases. So we have to consider like antidiabetic drug, rosiglitazone, which should be avoided in patients who already suffer from the heart failure. Drugs that slow down the heart like calcium channel blockers and beta blockers and corticosteroid that causes retention of the salt in water can also cause a heart failure. So in heart failure, we cannot give such drugs like a calcium channel blocker, beta blocker, or steroids, corticosteroids. Estimizole, terfenadine, these are all anti-allergics, and cisapride can affect the electrical activity of the heart, causing prolongation of the Q interval and resulting in the condition called the Tardas T pointer. So these anti-allergics are very dangerous. They can cause effect on the electrical impulses which is generated from S node, AV node, go to the frontal lobes and Purkinje fiber, can be delayed and can cause serious cardiac side effects. The changes of these side effects are particularly high when one of these drugs is administered with drugs that prevent its breakdown, like erythromycin and ketoconazole. So, if a patient is coming to the doctor and the doctor prescribe and patient has got a throat inflammation, tonsillitis, for example, and as well as he has got a fungal infection, and doctor has given a combination of uh, two drugs. One is anti-allergic and one is ketoconazole. That can lead to the Cauda's dysbiosis. Skin effects. The skin is the most obvious part of the body, and therefore any reaction is very easy to notice. Drug-induced skin reaction may be acute or chronic. The acute reaction may vary from a simple rash and itching to a serious condition like angioedema and Stevens-Jones syndrome and toxic epidermal necrolysis. Drugs that often cause acute skin reaction include penicillin, sulfonamides, allopurinol, anti-gout metabolism, and those that treat seizures and mental illness like anticonvulsant and antipsychotic. So there are a lot of examples you have seen here, the drugs which are affecting on the skin. Give a thought of all these mentioned side effects of the drug on different part of the body, either on the vital organs like heart, either on your stomach, causing stomach bleeding, or either on the skin. The special type of skin reaction caused by the drug is called the fixed drug reaction. Here, the skin lesions appear only on a particular part. Fixed drug reactions are noted with tetracycline, barbiturate, and sulfonamide. The blood-thinner warfarin can also rarely cause the necrosis of the skin. Sulfonamides, chloroquine, which is used in malaria, tetracycline, which is antibiotic, can produce a photosensitivity reaction. Means if the patient will go into the sunlight, he may get skin eruptions, which is a skin reaction that develop when the patient taking these drugs is exposed to sunlight. Therefore, patients on these medications are asked to avoid sunlight while being treated. So we have to take a lot of precautions. Hydralazine, bronchodilator, and procomide causes a chronic immunological reaction called the SLE, systemic lupus erythematosus-like syndrome, that also affect the musculoskeletal system, kidney, and brain. So you have observed that drug is not only and only for the use of treating the patient, but these drugs are causing a serious side effects. Brain is now the anti-tuberculosis drugs like isoniazid, INH, interfere with the utilization of the vitamin B6 and causes neurological symptoms ranging from a peripheral neuritis to mental disturbance and rarely seizure fits. Theophylline is a bronchodilator and antihistaminic medication, if not maintained within normal level in the blood, can cause neurological symptoms like restlessness and tremor, which may also progress to seizure along with the abnormal heart rhythm and shock. Some of the older antipsychotic drugs like clofenadine, haloperidol can cause movement disorder like acute dystonia, abnormal muscle spasm in the facial muscles, akathisia, a compulsion to move, Parkinsonism, malignant neuroleptic syndrome, which result in stiffness and tremor, and tardive dyskinesia, which occurs later during therapy. So with antipsychotic drug also, we have certain effects. Pregabalin, barbiturates, and benzodiazepine, which are the antipsychotic, can cause excessive sleepiness. Patients taking such drugs avoid driving or using dangerous machinery while on the medication to prevent accident. Then we'll see certain drugs which affect on your lungs. Drugs used for the treatment of cancer, methotrexate or bleomycin, cause scarring of the lungs called pulmonary fibrosis or interstitial pneumonitis. The patients suffer from the breathlessness and non-productive cough, which can worsen it if the dosage is not lowered. Amiodarone is a non-anti-cancer drug that also damage the lungs. Aspirin and non-selective beta blockers like propranolol beta blocker can cause a asthmatic-like condition, making it difficult for the patient to breathe. These should be avoided in patients with pre-existing asthma. In action, any drugs can cause a severe allergic reactions that mimic an asthmatic attack. So we have to keep consideration all these consideration in our mind before starting any treatment. As a pharmacist, you must have a knowledge of the drugs. That these drugs are giving a benefit to the patient, but also causing certain side effects, and which is very dangerous for the life of patient. Now we see the digestive system. Certain drugs are affecting on the digestive system. Let's see what they do. Non-steroidal painkillers and corticoids are well known to cause stomach ulcer, especially when taken on an empty stomach. Bisphosphonates, which is used for the osteoporosis, used in the treatment of osteoporosis, can cause esophageal ulcer if taken with a small quantity of water and are advised to be taken in an upright position, not while sitting. You cannot take a bisphosphonate like the drug in this group is alendronate sodium. Diarrhea can be caused by the nearly every oral drugs, iron salts, and loperamide can cause constipation. Loperamide is used as a antidiarrheal. The liver is the site for detoxification. Some drugs, however, affect the liver, causing serious problem. High dose of acetaminophen means paracetamol and, and or otherwise safe drug in normal doses causes liver toxicity, hepatotoxicity. So paracetamol or acetaminophen is a hepatic toxic if given in higher doses. Several first-line anti-tuberculosis drugs that include ironate, rifampicin, ethambutol, paracetamide causes liver damage and reduce the option for the treatment of tuberculosis in these patients. The amiodarone, methotrexate, valproic acid are some of the other hepatotoxic drugs. These drugs should be avoided in alcoholics and other patients who already suffer from liver disease. Pioglitazone, an anti-diabetic medication, was withdrawn due to its liver damaging effects. So liver is also very important. Liver damaging effects is also very important. If we do not consider these things, then it will harm to the patient. So under the digestive system, the accessory organs like the liver is the most important organ for the first pass, and every drug taken orally, it will go through the liver and liver will metabolize it, and then it will allow these drugs to be circulate in the blood circulation and so and move all over the body. So as we have seen that we started from drug-induced diseases, that means certain drugs which are very good for their efficacy and benefit to the patient, but also causes certain diseases or side effects. And we have discussed a lot of drugs like predictable or unpredictable drugs. One is we can predict it. For aspirin, we can say it will go higher doses, it will cause a GI bleeding. It will predict NSAIDs, of course, we can predict the propranolol if given to the asthmatic patient, it may enhance the asthmatic symptoms. So we should be careful for that. And then we have started certain drugs which is affecting on the specific system like cardiovascular system, like COX-2 inhibitor, rifaximin, which causes heart attack, right? So then we have observed certain drugs which are affecting on the skin and skin reactions, and we do not allow the patient to go into the sunlight or these drugs, certain drugs like sulfonamides and penicillins. This causes seizures and mental illness. So we have observed that certain drugs which is affecting on the brain and affect, for example, tuberculosis drug INH causes a depletion of the B6, then to create a neurological effect. Then we can say that theophylline. Theophylline is a drug which is a bronchodilator, which can affect on the heart rhythm shock. Then we have seen lungs disease drugs which are causing effect on the lungs, like anti-cancer drug, methotrexate or bleomycin, causes the pulmonary fibrosis. Then we have seen aspirin causes a GI ulcer, propranolol causes asthmatic-like effects. So we have discussed a lot of things. Then we have seen a digestive tracts in which certain drugs, non-steroidal painkillers causes ulcer in the stomach. So these all areas we have covered, we have observed that certain drugs they are very good for the purpose of your benefits which is required from that, right? And those benefits provided to the patient through the drug, but that causes side effects also, so you have to be very careful with that. So this is all about the drugs what we have discussed now, and we will see you in next lecture.